and welcome to our deep dive episode of FP Next, powered by John Deere. I'm one of your co-hosts for this farmer and rancher driven podcast, Sarah McNaughton, and I'm here with Curt Arns.
Hi, Sarah. Yes, we're powered by John Deere, so for all of your equipment and technology needs, see your local Deere dealer. Well, Sarah, winter has come back just a little bit. It's a little more seasonal than it was in mid-March these days, and a little more winter-like than it was in February and mid-March. And, you know, around here in early March, all the schools had a bunch of kids missing due to influenza B going around. Several schools had, double-digit absenteeism, I think, during that time, which is kind of a big deal. Our son Ben got influenza B and he was out of school for a week. High temperatures, achy joints, he just felt tough. So this is a kid that never gets sick. And when you feel rough and your kids feel rough, the last thing you want to worry about is what's it going to cost to see a doctor. So when my wife and I were farming back in 2010, we were pregnant with our fourth child, which was Ben. It didn't have great health coverage. I mean, we had really high deductibles like a lot of farm families. And it made you worry every time you took the kids to the doctor, how much you're going to have to pay for that office visit and tests if they were needed. And then that same year, our daughter Taylor had to have her appendix out. So that was scary enough for a young kid, but then we got the bill. So I think a lot of farm families are just like we were then. We struggle to understand health coverage and, what we're able to afford and what type of coverage we should be buying. So that's why our guest today should be really of great interest to our listeners, I think.
Absolutely. And I know maybe we're like a lot of farmers and ranchers who don't always make it into the doctor unless there's an emergency. Like I think the last time Cole's actually been to the doctor was a trip to the emergency room after there was an unfortunate incident gathering steers on a wild paint horse that left him with a broken arm. And so at the time, I don't think he actually had health insurance coverage. And so maybe the coverage plans we're visiting about today would have come in handy for us that time. Let's get down to our deep dive episode today and our guest. We want to welcome the Executive Director of South Dakota Farm Bureau, Krystil Smit. Krystil has been in her role with South Dakota Farm Bureau since 2015. She's an animal science and ag journalism graduate of South Dakota State University, so I'm sure she is still celebrating National Football Championship with the Jacks win this year. She grew up on a farm near Davis, South Dakota, and stays connected to farming through her farming family, rural community, and Farm Bureau membership. Her previous work has been with Tri-State Neighbor, South Dakota Corn Growers Association, and South Dakota Corn Utilization Council, as well as Paulson Marketing. And Krystil, that is quite a resume. We want to go ahead and welcome you to FP Next.
Well, hey, thank you so much. I'm so excited to be on with the two of you today. And as you were talking with Curt in Nebraska and you in Bismarck, I'm kind of just sandwiched between the two of you right here in South Dakota. So thank you so much for the opportunity to be on the show today.
So before we start talking about health plans, we wanted to visit with you a little bit about your farming life. And Curt, I think you've got the start of our question, so we'll get right to it.
Right, Krystil, you grew up on your family's farm near Davis, which is just north of where I'm at. Can you tell us a little bit about what the crops and pastures were like in that part of South Dakota this last growing season in 2023? It was challenging for a lot of folks. How about around Davis?
Well, just like everyone often talks about as we're dwelling on the weather, timely rains are critical for the growing season. Right in the southeast part of South Dakota where I live, a lot of corn, soybeans, alfalfa. Those are the main crops that we see in our area. But because Farm Bureau also represents the entire state of South Dakota, we're really in touch with what's happening in western South Dakota as well. And often we hear about drought as you move to the western part of our state, but they really got some beautiful rains this year. And the times where I was out west this past summer, the pastures were lush. The cattle were just completely happy. It was really extending the season for a lot of those ranchers to be able to have their cattle out on pastures. So actually down in the southeast part of the state, we probably didn't have that same amount of rain that came through here. So it definitely was a variable year, as it seems like it always is. But I would say it does seem like our drought conditions that we've been dealing with in the state of South Dakota have improved slightly this past year.
It's always good to hear about improved conditions, especially if some of those drought seasons up in the Dakotas and Nebraska and the Great Plains have been getting. And so I know that you are very busy between your farm involvement, your role at Farm Bureau, but tell our listeners a little bit about your favorite way to spend a day off with your family.
I love this question. And a lot of times when I get asked what my favorite hobbies are, I don't really have an answer to that. What I love to do with our family, touching back to what you mentioned earlier, actually, we were fortunate to travel to Frisco to watch the Jackrabbits win a second championship this year. So we love Jackrabbit football, especially, and we try to hit some basketball as well during summit tournaments. In the summer, our favorite place to be is on the river. And we're so lucky we live really close to the Lewis and Clark recreation area down in the Yankton area of South Dakota. And, that's where the Missouri runs through. And so we like to go down there and do some camping and boating as well. And we like to dabble with some golf, although we're not very good at that.
Well, when you get down to Yankton, you'll have to try out Lakeview Golf Course across the river in Nebraska, north of Crofton. That's a pretty good one with a nice river view, I think. Have you ever golfed there?
I have. Just this summer we were on there, and that was my first time on the course. And it may sound like I'm exaggerating, but truly it's breathtaking when you get to that spot where you can see the river from, I forget which hole it was, but you're absolutely right that you can't find a better view of the river right there.
Right. That's a pretty one. Mm-hmm. Well, we talked about weather just a little bit earlier, Krystil. Now, it seems like every farm family has one person that's particularly tuned into the weather. They worry more about the weather, they watch it more, and they seem to watch out for everyone else when it comes to the weather. So in my family, that's me. So who is your go-to weather person in your family when you were growing up?
Oh man, growing up, I'm going to say it was my grandfather. He was kind of the old school farmer's almanac, just had all the fog dates and, all the things that, they track through the farmer's almanac. And he watched the sun stages or phases, I should say. And I think that's something that I clearly remember from growing up, that my grandfather just was very tuned into the weather. And that was long before we had all the technology we have today. So it's amazing how much that they knew just about weather patterns from, just watching some of those cycles.
I know there's nothing we all like to talk about more than weather here in the Midwest, or maybe it's just because we're all in ag, but I know for our family, there isn't a specific person. We're all pretty watchy when it comes to forecasts, especially in the wintertime when it comes to travel. But anyways, we'll get down to our topic today because we could talk about weather and golf and fun things to do for the rest of the episode, or even important topic to talk about. So the USDA shares that most Americans with health insurance coverage receives it through their employers. And for those who are self-employed, which is most farmers and ranchers, healthcare is always maybe a concern floating around in their mind, especially covering the costs for emergencies and routine or preventive care for their families. And there are so many considerations when it comes to health insurance and health plans. How do we decide what product or company is right for our family, and where do we start?
Sarah, I am going to kind of go back a little bit to the beginning of when Farm Bureau decided to pursue a healthcare offering. That was one of our number one questions that we were getting from our farmers and ranchers is, can you help us with healthcare costs? As you already mentioned, most farmers and ranchers are self-employed. And so there's often a huge barrier in terms of access and affordability for healthcare. And as many know, a lot of times, one of the spouses in a farming operation needs to have off-farm employment just to be able to access that employer health care, as you mentioned. When South Dakota Farm Bureau had an opportunity to get legislation passed in our legislature, we went for it and we were successful in getting that passed. And so today we're just starting our third year of offering South Dakota Farm Bureau health plans. And you're exactly right. It can be very complicated. A lot of people will go out to the marketplace and view plans and try to figure out what's best for their families. And the exciting thing about our plans is they're very similar to any plan that you would be exposed to on the marketplace today. And so it's really a matter of families have to kind of take stock of what their present family situation is, whether you have children, or we also have plans. We have Medicare plans as well. And really, South Dakota Farm Bureau health plans can meet any family where they're at based on their needs. So we have different offerings in terms of deductibles and copays, which of course affects premiums as well. So, and I can get into more details, but it's certainly one of those things that I encourage people every year to at least take the time to compare what maybe their current healthcare coverage is, and just see what South Dakota Farm Bureau Health Plans has to offer.
As we talk about, all the different plans, and we've got folks, listening to the podcast from all over the country. So, they're all kind of in a different situation. One of the questions that kind of comes up and it's on my mind a lot is, how do you decide, like, where you should be at for deductible, where, what type of a policy or coverage do you need, depending on the size of your family. Let's get into the details a little bit about how you kind of decide those types, not just for Farm Bureau members, but also, just in general terms. I mean, you have a lot of expertise along this line. So I think it's a really important question for people to consider.
Yeah, Curt, that's a great question. And I think as you go into making those decisions, I think obviously your household budget comes into play, also the health and age of your family. I'm sure a lot of listeners out there like me, when my kids were little, we were going to the doctor a lot. There were well baby visits. Seems like the kids were constantly being seen at the doctor's office with the sniffles, and then as they grow older, the problems become a little bigger, whether it's a broken bone or something like that. So it really kind of depends on what's happening with your family. I really love our advanced choice plan with South Dakota Farm Bureau Health Plans, which really mirrors, again, like I said before, a health plan you might find in the marketplace, which would be like a $25 copay, just deductibles that are more moderate range, but then that does tend to mean that your premium is a little higher. We have families that have evaluated these plans and said, you know what, I would rather pay a little higher premium to know that I have full coverage if anything would happen. And we actually have a family that I'll share more about later that had a child who was in an ATV accident at the same time they were having a brand new baby. And so they had a lot of expenses within 3 days. And our healthcare plans just covered fantastically for them. But they chose kind of the Cadillac version of the healthcare plans. And again, that was kind of a stage of life decision for them. Deductibles run in that plan about $3,000, and out-of-pocket maximums for an annual year is about $5,000 to $10,000, depending on the plan that you go into. So again, but that covers all your annual visits, and just really anything that you would want to see a doctor for. You can count on that copay to be your only expense. And then as you move into other plans, whether it's a classic choice plan, again, basically the deductibles do go up. So that means a lot of times in family farms, they can absorb a larger expense, all at once, and I think sometimes family farmers will look at that and say, well, if we have to come up with a larger deductible over the year, we can probably plan for that. And will that mean that they maybe don't go to the doctor as much or, have a little older family? So I think it really depends. I really encourage people to kind of look at all the options. And what we've really found with our plans is people who have evaluated our plans against what they are currently on, most of the time they can achieve that Cadillac version of a plan for less monthly premium than what they're paying on the marketplace.
I know it's always so important to have that healthcare, especially in the event of an emergency. In our family, it's usually somebody getting bucked off of a horse or, like you're saying, those other accidents that you're not planning for. And then, of course, Curt and I are both involved with Farm Bureau in our home states. Actually, come to think of it, I'm pretty sure I'm overdue on my membership to renew it this year. But being a member of Farm Bureau brings so many benefits. Health coverage is just one of the big benefits members can elect to receive, as health plans through Farm Bureau can cover those unexpected expenses and healthcare. And farm organizations, of course, like Farm Bureau, have a great understanding of what these farm families go through and farm families in general. And so what are the big benefits of purchasing a health plan through organizations like Farm Bureau? And then another hot question is, what are the differences between health insurance and health plans offered through Farm Bureau?
Well, Sarah, I think, first of all, write a check to North Dakota Farm Bureau for your membership as soon as possible. Don't delay.
It's on my to-do list, yeah.
Well, and I think you're absolutely right when you think about why would you choose to go through a farm bureau for your health coverage. And while I can't say that our health plans, are specifically tailored to the agriculture industry. What I can say is it's being offered by people who understand the industry very, very well. And South Dakota Farm Bureau, just like many farm bureaus across the nation, have been around for more than 100 years. We all have gone in the past number of years celebrating our centennials. We're a very reputable, long-staying organization that is trusted by many farm families, not only for, whether it's different member benefits. Many of us offer property and casualty insurance that offers a lot of peace of mind for people having their farms covered, their autos covered, etc. And in addition to that, I mean, obviously, we're out trying to represent the best interests of our members every single year in policy conversations and in all the things that allow us to keep farming. And that all bubbles up from our grassroots. So, when you partner with an organization like Farm Bureau, you really have representation that are people just like the farmers and ranchers throughout the state that you live in. So I think that's really important. Now, to touch on your question about the difference between health insurance and the health plans that are offered through Farm Bureau. So our plans are not regulated through the Division of Insurance. And that's why we required legislation to allow our organization to offer health plans. Now, whether or not it's regulated through the Division of Insurance or not doesn't really matter in terms of if you have a question about your claim or if you feel that you have any concerns about your healthcare coverage, you're still going to have that due process and that due diligence that's available. But the reason we are not regulated through the Division of Insurance or considered actual health insurance is because our plans are rated, which means basically that you do have to go through a health assessment. There are pre-existing conditions that are considered. And a lot of times that's what determines what rate, what premium you'll pay, what plan you best fit into. And that also allows us to help keep premiums lower. So many people, a lot of listeners might think of this as kind of old school health coverage from way back when you did have to go through a basic health assessment, kind of your weight, your age, medications, those types of things are considered as you go through the application process. And that really determines what your premium and your plan looks like. What's exciting about all of that, a lot of times people think, oh no, a health assessment, nobody really loves, those checkups, if you will. But what I love about our plans is that even with people going through a health assessment, we still have about a 95% approval rating, which means 95% of the people who apply for coverage through Farm Bureau health plans are not only accepted, but they also choose a plan within our portfolio. So that's really exciting. To further add the strength of this healthcare option, so we actually partner with Tennessee Farm Bureau health plans. So many of you might know that there's a state farm bureau in every state in the nation. So it's just one big family. And we share resources and we support each other. And Tennessee Farm Bureau has had a health plan offering for about, I would say, 6 decades. So they started way back in the 60s with their healthcare offerings. So they've been doing this a really long time. They've got this figured out. And South Dakota Farm Bureau was kind of able to come under their umbrella and have access to the really robust plans that they've developed. And so it's not just South Dakota Farm Bureau. There's Tennessee Farm Bureau, Kansas Farm Bureau, Indiana Farm Bureau, Texas Farm Bureau, North Dakota just passed legislation. So I think as this continues to grow, not only does it show just this incredible need that that farmers and ranchers are looking for this option and this resource, but it also just really shows the strength of these health plans that are offered. And we also are able to offer, so we have a nationwide network of providers that is the largest network in the nation. And so in addition to that, like your healthcare coverage travels with you wherever you go. Currently, the offerings of on the marketplace in South Dakota, you can't go outside the border for coverage. Our health plans, if you're on vacation, your healthcare plan goes with you as well. So that's kind of a neat feature as well.
And that's kind of important for families who are living on borders of states and that kind of thing. That's kind of an important feature too. Are there any, new health plans, new products coming around the corner that you're aware of? And where can families go, for help and finding health coverage, and making these decisions? I mean, what kind of questions should they be asking no matter where they go for their health coverage? I mean, what kinds of things do they need to be considering to get the best coverage for their families?
Mm-hmm. Those are all great questions. Obviously, I'm so passionate about this program. I could talk about this for days and days. But one of the really unique things about South Dakota Farm Bureau health plans and the other Farm Bureau health plans out there is we actually have an agent network that we utilize within the state. And those are actual individuals that live within your community that you can reach out to and go in their office and sit down with them if you want to. Some people like that personal touch. Some other people would prefer just to go through an online application through the website. But if you would like to sit down across from another person and ask them advice about, obviously they're going to be very careful about giving direct advice about what you should choose, but you certainly can sit and have that conversation, share, basically your family's situation and all the individuals that you want covered. And those folks, those Farm Bureau agents have been through full training on health plans, and they also are, in most cases, fairly familiar with what's also available out on the marketplace. And so hopefully they can kind of do some education, provide that information to families, and so that they can make the best decision for their individual family. I think by having that agent network, it also has that person that you can call back to. And if, let's say, you've had a change of life situation, maybe you've had a baby, or maybe you have rethought your coverage and feel like, you know what, I think I would like to bump up to a higher level coverage. That person can help walk you through all of those changes. But in addition to that, Farm Bureau health plans are very unique in that enrollment is not like you think of with the annual enrollment with the marketplace plans. You can enroll in Farm Bureau health plans any time of the year, and you can make changes throughout the year. And also, if you would have a major health event, you can never lose your coverage because of a major health issue, whether that's cancer or any kind of disease or accident or unexpected health emergency. The only way you will not be covered after you've been offered and accepted a plan is if you don't pay your membership or if you don't pay your premium. So that is a huge peace of mind for people.
Absolutely. Especially, again, it's just having that coverage, that safety net there for you and your family. And so you touched on this a little bit earlier in one of our questions, but how do families find a balance between what they think they can afford and maybe what kind of coverages they actually need? And again, like we said, it kind of depends on if your family is young with young children, with those doctor visits and routine exams. What are the considerations that they should be thinking of, or what type of experiences have you heard from families who are already on these plans?
Mm-hmm. And I think, again, I've had the opportunity to talk to several of the people who are covered by plans throughout the state. And it ranges from people with small children to maybe couples who are empty nesters and families with teens in their household. Again, one of the great features about this plan is it's not individually rated. So it's one premium no matter how many people you have on the plan. So if you have a family of 10, you're not paying individually for those, for every one of those kids. So that's such a great feature. But I think one thing that people really have to keep in mind is, the peace of mind of coverage. And there's always surprises. Even at my age, I still have surprise medical things that happen throughout the year. So I think it's just really a matter of saying, would I rather pay $25 per visit and have a low deductibles so that I know my out-of-pocket costs are never going to catch me by surprise? Or do I have some money put away that I could absorb a major medical event? So I think people really have to take a look at their own finances and take a look at how you've already been saving and putting money away for medical expenses. A lot of people use an HSA or something like that allows them, they just have planned savings for their medical events throughout the year. So I really think it's all about planning. It's all about stage of life for families. And Sarah, you mentioned what have we been hearing already from families that are on the plan? I'll share with you, our vice president of the board of South Dakota Farm Bureau, he and his wife are on the plan, and they have saved about $500 a month from what they were paying for their health care coverage. And both of them had medical situations within the first year of being on the plan, and they could not be happier about how that plan performed for them. I'm not sure what plan they're on, but what they chose definitely took care of their family's needs. The family that I mentioned earlier in the podcast, who they were at the hospital waiting to get induced for their fourth baby boy when their oldest boy was involved in an ATV rollover that required air ambulance to fly him to the same hospital that they were at, waiting to get induced with their fourth baby. And it just gives you chills because, as the mom said, she said, I was focused on fighting for my oldest son's life while getting ready to bring my youngest son into the world. The last thing I wanted to worry about was our healthcare coverage, and they certainly did not have to do that because they were covered. And so I think there's no way of anticipating some of those situations that we encounter in life, but I think we all can agree that healthcare coverage is just such a necessity, but not just healthcare coverage. You want to have reliable, affordable, high quality coverage. And South Dakota Farm Bureau Health Plans, has a track record of being that for people.
Gosh, I couldn't imagine going through that, especially just thinking of the types of bills that can come from those instances, especially so close together. So I'm glad that those families that you mentioned had that coverage and had such good experiences. And thinking outside of South Dakota and, North Dakota, Nebraska, the areas we're all in, our listeners come from all around the country. And like you mentioned, there's kind of a network already through Farm Bureau, but wherever they might live, where can they go for more information to find out what health care plans are offered to them?
Well, right here in South Dakota, we have a dedicated website to our healthcare plans, and so it's sdfbhealthplans.com, or we have a quick way of remembering that by utilizing the URL livewellsd.com. And every state that offers Farm Bureau health plans has their own website that's dedicated to their offerings. So not every state offers Farm Bureau health plans. And again, quickly, Kansas has a very robust offering. So I would just say, Google your state Farm Bureau. So state name, Farm Bureau, and that'll take you to the website where you can find out more. And if that particular state offers Farm Bureau health plans. So as I said before, every year, this is growing in terms of this network. And again, I think it's just because, first of all, this is such an outstanding product that has been such a great answer for farm families. But in addition to that, there's just growing demand across the nation for affordable healthcare.
Krystil, we want to be sure and drop a link to South Dakota Farm Bureau for the health plans with the episode description.
And on that website, you can find out direct information about all the plans. You can read about all the deductibles and the out-of-pocket maximums. You can find agents who represent the health plans. You can see if your doctor is in the network. And what we have found is the network is, like I said, it's this robust vast nationwide network. And for the most part, it has pretty much every doctor that you can find on any of the marketplace plans as well. And you can also, on our website, actually get a quote based on your family's situation. So you can go through a quote application on the website, fill in your information, and get just a relative idea of what the premium might be.
Yeah, that's perfect. And it gives our listeners an opportunity to kind of do some research. If they check out the South Dakota Farm Bureau website, then they can kind of compare, with maybe the Farm Bureau health plans in their own states or other, plans out there. So that's a good way to go. We want to thank you again, Krystil, with South Dakota Farm Bureau for coming on the show today. Krystil's offered some really great advice for farm and ranch families who are trying to navigate that really complex healthcare platform situation out there. So hopefully, the information that she gave us today will really help folks out. We will make sure a link to South Dakota Farm Bureau is with this episode description so our listeners can follow up if they want. Thanks again to Krystil Smit with South Dakota Farm Bureau for coming on the show today. She offered great advice for farm and ranch families trying to navigate the health insurance platforms out there. Well, that's it for this deep dive version of FP Next, powered by John Deere. To our listeners, we want to thank you for listening to this episode of FP Next, allowing us into your tractor cab, your truck, on your farm, and in your fields. A special thank you goes out to our digital production and marketing team members who put in a lot of work with us. And if you want to be sure not to miss any top stories, sign up for our Farm Progress text blasts, which bring the hot stories right to your inbox.
And you can sign up for those text alerts by texting FARM, F-A-R-M, to 20505. And be sure to follow Farm Progress on social media to stay up to date with ag news and more. And check out the digital edition of your regional publications at farmprogress.com. And we teased this in our last episode as well, but we're very excited to welcome Prairie Farmer staff writer and Illinois farmer Betty Haynes on to our next episode to talk about how to stay safe and sane during busy seasons on the farm.
Yes, this is a great topic, and we know that Betty will have some good advice for navigating those busy growing seasons ahead for your farm family. So we really look forward to visiting with her.
Definitely. Follow along with FP Next by listening and subscribing on your favorite podcast platform. And we're now on YouTube and Farm Progress Online. So there's no excuses. You can listen to us just about everywhere. And be sure to leave us a review while you're there if you enjoy the show.
And we love 5 stars.
Absolutely. And remember, if it's agriculture, your friends at Farm Progress have you covered. Here's wishing you high yields and good weather. We'll see you next time.